Today we're going to review the first clinical practice guideline from the American Academy of Pediatrics for opioid prescribing for acute pain management in children and adolescents in outpatient settings. This was published on September 30th, 2024. The objective of the summary is to aid clinicians, patients, and their families in understanding when opioids may be indicated to treat acute pain in children and adolescents and how to minimize risks associated with the use of opioids, including opioid use disorder, poisoning, and overdose. Throughout the summary, we will refer to opioids, which includes but is not limited to codeine, fentanyl, hydrocodone, hydromorphone, methadone, morphine, oxycodone, oxymorphone, tramadol, and others. The process of the AAP for developing these guidelines is meticulous and time-intensive. Guideline development involves a thorough review of the relevant research and close examination of the strength of the studies and other identified documents. This process also considers the benefits and risks of specific practices. Speaking of strength of recommendations and evidence quality, here is a quick description of each. The strength of recommendation integrates evidence quality appraisals with an assessment of the anticipated balance between benefits and harms. This leads to a designation of either strong recommendation, recommendation, option, or no recommendation. Option is a may statement that is typically applied when there is a balance between risks and benefits of an intervention or when the evidence is weaker but there is still a perceived benefit. Compared with option with no recommendation, there is a lack of support for either for or against an intervention. The explanation of evidence quality rating is broken down to A, B, C, D, and X. A is well-designed randomized controlled trials, or RCTs for short, or diagnostic studies on relevant populations. B is RCTs or diagnostic studies with minor limitations or overwhelmingly consistent evidence from observational studies. C is observational studies, case control and cohort design. D is expert opinion, case reports, and reasoning from first principles. And X is exceptional situations where validating studies cannot be performed and there is a clear preponderance of benefit or harm. Now let's jump right in and explore the recommendations and takeaways from this guideline. Acute pain should be treated using a multimodal approach that includes the appropriate use of non-pharmacologic therapies, non-opioid medications, and when needed, opioid medications. This is a strong recommendation, evidence quality B. Opioids should not be prescribed as monotherapy for children and adolescents who have acute pain. This is a strong recommendation, evidence quality B. When prescribing opioids for acute pain in children and adolescents, immediate release opioid formulations should be used. Start with the lowest age and weight appropriate doses, and unless the pain is related to trauma or surgery with an expected duration of pain of more than 5 days, provide an initial supply of 5 days or fewer. This is a recommendation, evidence quality C. Codeine or tramadol should not be prescribed for the following: children younger than 12, adolescents 12 to 18 who have obesity, obstructive sleep apnea, or severe lung disease, when treating post-surgical pain after tonsillectomy or adenoidectomy in children and adolescents younger than 18, or when treating acute pain in patients of any age who are breastfeeding. All of these are strong recommendations, evidence quality X. Use caution when prescribing opioids to children or adolescents who are taking sedating medications such as benzodiazepines. This is a strong recommendation, evidence quality X. When prescribing opioids, provide naloxone and counsel patients and their families on the signs of opioid overdose and how to respond to one. This is a recommendation, evidence quality X. When prescribing opioids, educate caregivers about safe storage and directly observed administration of medications to children and adolescents. This is an option, evidence quality D. When prescribing opioids, educate caregivers about safe disposal of unused medications, help caregivers develop a plan to safely dispose of unused medications, and, if possible, offer safe disposal in their practice setting. This is a strong recommendation, evidence quality A. When treating acute worsened pain in children and adolescents with pre-existing chronic pain, prescribe opioids when indicated and partner with other opioid prescribing clinicians involved in the patient's care to determine an appropriate treatment plan. This may include specialists in chronic pain, palliative care, and/or opioid stewardship programs. This is an option, evidence quality D. So there you have it, a recap of the new AAP guidelines for opioid prescribing for acute pain management in children and adolescents in outpatient settings. For more information on this guideline, or to access the summary, patient summary, or any of our other resources, visit us online at guidelinecentral.com or download the Guideline Central mobile app available on iOS and Android devices. This has been another Guideline Central production, and we'll see you very soon for the next one.